some of the other speakers have highlighted that this is a fundamental gear change and this is something completely unprecedented. But work that I've done on previous outbreaks and work of colleagues of mine in this gender and COVID working group that I'll talk to in a minute, we've looked at the gendered vulnerabilities and gendered impacts of major epidemics and outbreaks previously. And actually, I think that a lot of it isn't unprecedented. A lot of it is exactly the same trends that we've seen in Zika, that we've seen in Ebola, that we've seen in cholera outbreaks. But I think what is giving me hope and what I think is a change is the recognition of it, right? We've been beating this drum and saying, like, where are the women, right? Asking that simple question to policymakers, to practitioners. And I think the fact that we're having this conversation and the fact there's been so much media coverage, social media coverage of the issue of the gendered impacts really encourages and gives me hope that maybe it's time that this will get recognized, not only by those of us who, work in this space and are feminists, but by the broader policy community. So I want to talk about three things this evening that I think are really important when we're talking about gendered impacts of COVID. And I'm hoping this is going to sort of complete a bigger picture that other speakers have talked about. So the first one is around the visibility question of women. So far we've talked about women as pregnant women. We've talked about women as victims of violence. And I want to think about the kind of everyday woman, right? And the impact that women are having globally of this outbreak, right? Which is that our lives have changed, right? And that, when schools close, who is it that's going to pick up the additional burden of childcare? Well, social norms of reproduction and social reproduction tell us that that's more likely to be women than men. We also know that domestic households have changed, right? Who's doing the additional cooking that might be happening during the day? Who's doing the additional housework that is, because everyone's in the house the whole time, you're making more dirt. It's those everyday experiences that also need to be talked about. Because we imagine from previous outbreaks and from more general norms of gendered norms that this is going to be for women. And not just thinking about sort of everyday women in terms of your private life, but I think another group that we need to think about are the other formal and informal workforce that are predominantly women. So the main one that I think we need to talk about is healthcare workers that Megan alluded to. So 70% of the global workforce is women, global healthcare workforce, particularly frontline healthcare workers. And this is up to almost 90% in Wuhan, where the epicenter of the outbreak was initially. And the problem is that we also know that we are seeing trends of the outbreak appearing amongst healthcare workers. So if you're seeing, increased rates of infection amongst healthcare workers, and most of those healthcare workers are women, we need to know that. That's a really important finding. And so this is really a plug that we've heard across the speakers tonight, is we need to get more sex segregated data to show this, right? I know that currently there aren't global sex segregated data sets that are comprehensive. UN Women did an amazing job this week publishing the most up-to-date statistics they've got on it. But that was only 400,000 odd cases, all right? And we're now at 1.5 million. And important to know, out of those 400,000 cases they've got data on, 150,000 of those are from Spain. So my question is, what are other countries doing, and why aren't they reporting this sex segregated data? Particularly because the Spanish data that UN Women have published shows that there is a spike of infection amongst women healthcare workers, right? And it's really stark and significant, that spike. And so we really need this data, and it's a plea to policymakers to make this data public so that we can then ensure that we can push policymakers based on numbers, which is what policymakers like, to ensure that women frontline healthcare workers have the necessary protective equipment to stop infection, right? That have the necessary breaks from work, right? They even have the necessary sanitary protection. We heard stories in China of women not being provided with sanitary products while they were, on their ward round. So we really need to ask these questions. But then there are other formal and informal workers that I think is a really important group to think about, is the sort of domestic household or informal workers that we see in domestic spaces globally. Interestingly, the first person to have died in Brazil of the coronavirus outbreak was a female domestic worker working in a household for a middle-class family who'd come back from Europe, right? And recognizing this domestic burden and the role that women play in the domestic world and life cycle, and that this is their job, is a really important factor and potential vector for disease spread. So we need to recognize the everyday women in this. And, this extends to hospital cleaners and delivery drivers and whoever else we see these low paid jobs. This is particularly important in low middle income settings where, we're seeing these, we know that people have to go out to work to eat, right? To be able to, their daily income is what they need. And so social distancing is going to be a lot harder for these lower paid women than maybe other categories. So it's really important to think about. I am really aware that we're running out of time, and I want to allow time for questions, but I just wanted to touch on the Gender and COVID working group that Megan mentioned. So some colleagues of mine from various institutions globally got together at the beginning of this outbreak, having worked in similar questions around gender and pandemics and gender and epidemics previously, and we formed a Gender and COVID working group. The idea of this was to be a space for anyone who was interested to share ideas, share research, pitch ideas for collaboration. And so, it's very nascent, but we are definitely, facilitating conversations which we hope otherwise wouldn't have happened or wouldn't have happened so holistically. So a plea to anyone who wants to come and join us, please do get in touch.